What's your latest there?
Nice segue, Al Roker. Nice segue. It's a question many of us ask ourselves every day, especially around here. Why am I so tired?
Now with our jet lag, well, it may not be because of a lack of sleep. It could also have something to do with your diet and your daily schedule. So here with some solutions are Dr. Carol Ash, Director of Sleep Medicine at Meridian Health, and Julie Bain, the Health Director at Ladies Home Journal. Good morning, ladies.
Hey, ladies.
Good to have you here. So the question a lot of people ask, why am I so tired? And you start, Doctor, by asking people, by having them ask you some questions.
Yeah, two simple questions you want to ask. What does the word mean to you, I'm tired? Because you can be tired of the conversation and not just fatigued. So we use the word for different things. And what do you think the problem is? Because sometimes you actually know what the problem is. You just don't know how to solve it.
All right, Julie, so let's tick through some of these. One of the culprits is mental exhaustion.
Yeah.
Let's define it first.
Well, stress. Stress really takes a toll, and women especially, they're the worriers of the family, and they're more subject to anxiety than men are. So even if you go to bed at a decent hour, there's that thing at 2 a.m. eyes pop open, and you're like, oh, I forgot to do this. How am I going to pay the bills?
So how do you combat that? What do you do about it?
Well, you know, as Julie's pointing out, stress is a real problem. And stress, it's a good thing. It helps us overcome challenges and learn new things. But when it's sustained stress, it can lead to anxiety and depression. And what I'll tell patients to do, that stress can make you feel tired, but that stress will keep you up at night. And if you're sitting up at night with those thoughts, you got to write it down. And then the next day, reach out to a trusted friend or professional to help you cope with it.
So you say keep a journal by your bedside, perhaps, and you also say avoid abusive relationships.
You want to, you want to be realistic and extract yourself out of situations that are really not good for you, a work relationship or a personal relationship, because it can be exhausting mentally.
All right, Julie, let's talk about sleep debt. It may be that you're getting enough sleep, but you're on kind of an irregular schedule. You say keep it consistent?
Yeah, like if you've been in Sochi for a couple weeks.
For example.
But, you know, we all stay up late to watch, like, the premiere of a new show, or we're wired 24/7. Oh, let's just check the phone one more time. You know, keeping a strict schedule can make all the difference.
Sometimes, though, the factors that are causing that sleep debt are children, worries.
Sick.
How do you,
caretaking of aging parents.
Exactly. So how do you handle, I mean, some of these things are out of your control. So what should you do, Doc?
They really are. One of the simple things you want to do, there's a clock in your brain that'll help you keep a schedule. So you want to get up the same time every day, even on weekends. Take a nap if you need it. And exercise. Exercise is great any time of the day to help you decompress and just help you sleep at night.
So we're not allowed to sleep in on weekends? So we have to wake up at 4 a.m. on the weekends?
Sorry, Lily. A little bit.
That's devastating. That's devastating.
Let's talk about nutrition and how much nutrition plays into this. What kinds of foods can actually disturb your sleep, Julie?
Yeah, well, you know, the studies are so interesting on the Mediterranean diet, which is based on classic whole foods, and so eating well, antioxidants, not too much junk, not too much caffeine late in the day, not too much alcohol right before bed, and not a huge meal right before bed, which a lot of us do that sometimes.
I was going to say, I like the idea you say shop the periphery of the supermarkets.
Absolutely. Shop that perimeter of the supermarket. Because, sugar, calorie-dense foods and the processed foods are all in the middle. And calorie-dense foods and carbohydrates, they can cause tryptophan to be more available to the brain. That'll cause you to be drowsy.
And if you've tackled all the things we've mentioned here and you're still having trouble, you're still exhausted all the time, is it an indication that maybe you should look into a bigger health problem?
It absolutely is. Anemia, thyroid disease, cardiac disease, all of those things can cause you to be fatigued. So you have to consider those other options, too.
We were surprised that one doctor even told us that gum disease, for example, creates inflammation in the body. And so even a dental problem can make you exhausted. You have to fight off this inflammation. So go to the dentist.
Get everything checked out. Julie and Carol, thank you so much.
Thanks,
Good
ladies.
to have you here.
Appreciate it. Coming up next.